And with us now is Dr. K, Dr. Kevin Kavanagh. Good morning, Dr. K.
Good morning, Jack.
Man, I tell you what, you outdid yourself on Friday's show. We had this doctor from Germany who was on with us, and he was terrific. You tell me, is a real up-and-comer, huh?
Well, I think definitely. He's a very knowledgeable and extremely intelligent researcher out of Germany and also a compassionate pediatrician. And I'm very, very impressed with him. He, as I said, is the individual who I believe first reported asymptomatic spread, documented this on an airline coming in from China into Germany, and published this and obtained quite a lot of notoriety over that. And he is one very good person who I believe has a good heart. And some of the take-home messages are, one is in Germany, they require masks in school when there's high viral spread, and they use surgical grade or higher masks. They don't use cloth masks. And the other thing is testing. They test 3 times a week in school if you're not vaccinated. And I thought those were excellent revelations.
I saw this online this morning to back up what you're saying there. New data from the Centers for Disease Control and Prevention says that outbreaks of COVID-19 are more likely in schools that don't enforce mask updates. They suggest last Friday in a report supported by the CDC's suggestion for universal indoor masking, a study in Arizona showed that schools not requiring masking were 3.5 times more likely to have outbreaks of the virus compared to those that have mandates in place. So there you go.
Well, definitely. And even cloth masks will provide protection. Again, surgical masks, little higher grade of protection, but cloth masks will still protect. Not only protect the person, but also protect others. And remember, what you're trying to filter out with these masks are droplets. They're smaller droplets, between 10 to 100 microns, but masks can filter those because that's what's produced when you speak. It's not the dry viral particle that's measured on electron microscopy. It's these small droplets that can aerosolize and that come out of a person when they're speaking or talking. And so that's what the masks are designed to do. And they're just a layer of protection. You also should have testing. You also should have increase in ventilation. And if possible, have potting cohorts. All of this is important to try to keep our students as safe as they possibly can be.
Okay, everybody that's over 65 or that has some other problem, health problem, is interested in getting a booster. Tell us about that. That's now available or will soon be available, and where do we go?
Well, they should be available now. Pfizer boosters are the same dosage as the original shot, and just go to a drugstore and inquire if they're currently giving them out. I think many will be doing that. If you're a frontline worker, occupational exposure, you're at high risk for COVID-19, you certainly should be thinking about getting a booster. If there's any doubt or you have any other reason why maybe you don't want to get it, then of course talk to your physician about that. But I need to add that a number of vaccines, whether it's hepatitis B, whether it's polio, they require multiple doses in a course. And this is over many months, sometimes years. So the fact that you're getting 3 doses really probably is going to become the normal dosage regime for this vaccine. And it's not unheard of. What is unheard of is getting 1 dose and you're done. Usually a vaccine requires more than that in order to get your immunity up to the level where it should be to provide adequate protection.
So the people that got the vaccine other than Pfizer, if it was one of the other 2 brands, is it okay to get the Pfizer booster?
That I would definitely talk to your doctor about. The data on mixing and matching is not in yet. We did have actually one study that was presented at our conference this year out of Spain, and they felt that mixing and matching actually might be beneficial in certain instances, but it really does depend upon what vaccine you're getting and then what booster you're getting. But right now, the boosters are just approved for those that have had Pfizer that get a Pfizer booster. Now,
I got you.
Moderna vaccine provides a higher immunological response, and they're not seeing as many breakthrough infections, and immunity, although it's still waning, not waning nearly as fast. Remember, the Moderna vaccine Initially, it's given 4 weeks apart instead of 3 weeks, which is an important differential. It adds a little bit to the immune response. Of course, we found that out later. And it also has over 3 times the amount of mRNA in it. So that's one of the reasons why you may get a few more side effects when you get the vaccine. But it also appears that although immunity is waning, it's not as quick as the Pfizer. So they're going to look at more data on that before making recommendations. Johnson & Johnson, I'm afraid, Jack, there's just no data out on that. It's very difficult because it's a different type of vaccine. It's very difficult to advise what to do, and that's really a failing of our healthcare system that we don't have that data. We certainly should. We should be like Israel, getting abundant data, releasing it to the public immediately, and we're not there yet.
And there's like AstraZeneca and maybe another brand or two that are available in other countries. Would you support them being available here too, or is that necessary?
I don't think it's necessary. AstraZeneca had some problems with the variants. So I would myself stick with either the Johnson & Johnson or the mRNA vaccines. Let's use the vaccines on the ones that we can gather data on and detect problems. If you start to dilute your pool of subjects or patients, it then becomes harder to detect these rare types of complications which could occur.
What else do we need to know this morning, Doctor?
Well, the big thing is monoclonal antibodies. I do encourage people who are getting sick to go out and get monoclonal antibodies. That's very important, but remember, they are not a substitute for the vaccines. Definitely not. There are only 1 or 2 antibodies. The vaccine produces a plethora of antibodies. And if you look at all the variants that are out there, we were in some aspects lucky because Delta is susceptible to 3 out of the 4 monoclonal antibodies. But the other variants, such as Beta, Gamma, and the Delta Plus variant, which we were very worried about, they're resistant. So monoclonal antibodies is just a patch. And also, they have to be given very early in the course of disease. And all these glowing reports of efficacy, remember, almost all that data is pre-Delta. So it's hard to predict how one variant will react or be susceptible to a medication as opposed to another variant. So again, they're good to get. Please ask for them and do it early, but no substitution for the vaccine, which may protect you against future variants.
And wasn't there a story a week or 2 ago that the monoclonal thing was in kind of short supply?
Well, yes, because they have to make a whole bag of stuff instead of just a little amount that goes in the vaccine. The vaccine causes your body to make the antibodies. Much safer, much better doing. You can still react to that big bag of infusion that's going into you. And like you said, they're in short supply. And you can say, well, why don't you gear up to make this? Well, because the next variant 3 weeks from now could well be resistant to it, as are those variants that I just talked about. Yeah. So it's not a good strategy. The best strategy is the vaccine. Easy to get, right. Very safe. It just amazes me why people aren't doing it.
Dr. Kevin Kavanagh, always good to talk to you. We'll talk to you Friday. Thank you.
All right. Thank you, Jack.